Good morning, everyone. Um, it's day 2 since I've had the penolectomy. Did I say it right?
Close enough.
I said close enough. Anyway, to me, I would call it like a mini, what's that called?
Tummy tuck?
Yeah, like it could be like a mini tummy tuck. That's what I'm going to call it. I'm stubborn. So anyway, this morning I'm going to be getting my drains changed, and it's very simple, but it's not something you do for yourself. So I have my husband who's going to do that in a moment. But I wanted to tell you guys a little bit about how I slept. I slept in this recliner of my husband. They bought it from his man cave, and the position that you need to be in after you get this surgery is just like this: elevated head, and your knees have to be up like there. And so I am still not having excruciating pain, and I'm thankful to God for that. Like I tried to tell you guys yesterday, I was very clear with the docs that I definitely have to be able to have my pain controlled. So I needed extra medicine, IV medicine, while I was in surgery. So then when I came out of surgery, it lasts longer. Because once you get through the first 2 days, not to say you're golden, but you're feeling better. So that's what's going on. And then we're going to go ahead and I'll show you what's going on down here a little bit later today. Okay, now we're going to go ahead and get these changed. Sorry.
Yes, okay.
Sorry.
So I'm cleaning off the port, the drains with an alcohol pad. And then once we remove the cap of the reservoir, we clean that as well. And now that the reservoir has allowed the air to fill in, we're going to drain all of the fluid off, being careful not to allow the bulb or the reservoir to be released, because we have to maintain a positive suction, and the bulb will refill by pulling the drain out of the abdominal cavity. We have to measure the amount of fluid that is in there and document it, because the provider wants to know how much fluid every day is drained. So out of the right drain, that had 20 milliliters. Same steps. We take alcohol pad and we clean along the line of the drain.
That's something. What was that, Lisa?
Every 4 to 6 hours we check it, but at a minimum we have to drain it twice a day.
Oh.
And once again, you see how the bulb is collapsed, and that allows the pressure within the bulb to act more of as a suction to continue to pull the fluid out of the abdominal cavity.
So this is somehow inserted into my wound, right?
In the cavity, yep.
In the cavity? Okay. And they take this out at the doctor's office?
Yep. So we have a total of 50 milliliters. So we had 20 on the right, so that means 30 came out of the left. And I'll annotate this, and that way she can inform the surgeon at her follow-up.
Thank you, babe. Okay, well, anyway, guys, I'm gonna look at getting a little bit of rest. And I'm more tired than in pain. I did make sure to take my medicine, though, because even though I wasn't in excruciating pain, keep the pain down, because I'm a baby and I cry over pain. So that's it. That's all. I'll be back.
So good. No blood. A little bit of bruising right here. And maybe just a little bit over here.
No blood nowhere?
No blood nowhere. It looks great. I wish I could take the Velcro off.
I know. They said 2 or 3. That's where my port for the drain. That's where it's at. And then I keep my drain in my pocket right here. So I just put that away. But needless to say, so today is like day 3. And I didn't get to finish yesterday. I went to about a 5 in pain yesterday. One of my daughters gave me a little sponge bath, and that just felt delightful. Because I was tired and stuff, and I'm not able to rest very well. That's worse than the pain. My pain has never went over about a 5.5. So that's a blessing. But you have to be upright, and your legs should be up and bent. But mine are not up and bent the way they need to be right this minute, because I had to take a break because my knee got tired of that. So I'm just taking a break from that, and I'm just kind of making sure I'm sitting upright or at an angle in the bed. And that's not easy to really get a lot of sleep like that. So anyway, that's where we're at. We're doing okay though, and hanging on in there. I got a lot of help, so I'm just recovering and doing better than I thought I would be doing by now. But it's all because they gave me like a lot of different numbing medications and topical numbing medications and medication when they were doing the surgery, that between the anesthesia and the doctor. Because I ended up having to call her about a prescription for the medicine over the weekend. And so she gave me a call back right quick, and she told me that she sent my a different prescription over there for me to have. And when I talked to my surgeon that day, she also told me that she had filled it up with some kind of numbing medication. She put it directly in the wound, while when she cut it, to remove the skin and the fat and stuff. So that's where we're at, and so we're looking forward now. All right, we'll be back as much as I can. Okay, guys. Here's how the pump is looking. It's starting to run clear, so I don't know what that could indicate. Maybe that's just a good thing. And we'll just let a good thing be a good thing.